You've looked at retirement options, you've planned well, you've invested wisely, and yet you can hear it, tick, tick, tick of a time bomb. That time bomb is healthcare costs, and they could explode, blowing up your retirement plans. To defuse this bomb, we've brought in our own bomb squad, Jim Lineweaver. Jim's a financial planner with the Lineweaver Financial Group. Thanks for joining us today, Jim.
My pleasure.
All right, so healthcare costs, we know that they can be huge. They can really affect our retirement in bad ways. How much should we be saving on a monthly basis leading up?
This is big. You
health.
really have got to have some way to bridge this gap in retirement, because if you retire early before Medicare kicks in, you could be looking at $1,000, $1,500 a month. So it's a huge expense. As a matter of fact, Fidelity.
Some people don't even get $1,000 or $1,500.
Right, from Social Security or anything, right. But when it happens, so it's a huge problem. And back in 2002, Fidelity did a study and said on average you need about $160,000 saved just for health care costs. And today, that number is up to $250,000. So that's about a 56% increase.
So a lot of retired seniors, are they still covered by previous employers' health insurance?
Sometimes they can be, and this is what you really have to weigh. If you obviously are before age 65 and you need to get the health insurance, see what your company offers, because a lot of times you're still in a group pool, lower benefits can really work extremely well.
Good.
And hopefully they offer that benefit. If not, you got to get out there on your own, see if there's some other associations you can join to. But you're really trying to bridge the gap until age 65 when you can qualify for Medicare.
Right, so if you don't have an employer that's going to offer health care coverage, then where are you?
Look at your spouse, see if you can pick up spousal coverage, and gosh forbid if you jump on their plan, which a lot of people have the luxury of doing, unfortunately they would lose their job too before you turn 65. You do have a provision in there where you might be able to go back on another plan. So look at any community service organizations you can join, possibly if you have some business out there that you think you might be able to generate a few dollars on, try to go through Cozy or something like that. Try to do whatever means you can to try to get some type of group coverage out there.
And there's a whole lot of solutions you've been collecting and putting together. Can you give us a list?
Yeah, there's several, one of which is in our special report. And this is a report that we put together for police and firemen, but it applies to a lot of different industries, because in here it does reference something from the 2006 Tax Act where some companies and employees are able to benefit and get a tax deduction for their health insurance. So that's one of them. There's also a lot of different ways that you can do it. We mentioned Cozy, we mentioned some other options, but you really have to look into this. And one thing I want to mention to people on this Medicare issue is that even if you're working in the public sector, make sure you get your 40 credits in with Social Security, because if you don't, when you get to Medicare at 65, you may be paying an additional $200 or $300 a month because you didn't get enough credits in. So make sure you get enough credits even if you're not in the Social Security system.
We talked about group coverage. Do you look at different groups that you've belonged to over the years? Do you have to belong to a group today? What is there any benefit there, solution there?
Yes, anytime, and you can go through usually your community centers or any type of organization that you've belonged to in the past. Sometimes unions have them, engineering societies have them, a lot of different things where you can just get that collective rate to try to lower the cost as opposed to just an individual plan.
And sometimes people actually go back to work just because they needed some health, they need to get health insurance.
Unfortunately, they do. They can't retire because of it, and some people don't even retire because of it.
Wow.
Until after age 65.
Well, I looked at the report. Very helpful. Thank you, Jim. Appreciate it. Thanks for your tips.
My pleasure.
Time's ticking away. Tick, 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 tick. And failure to plan for health care costs in retirement could blow up in your face. For help, talk to Jim or get a copy of his free special report on the myths and realities of Ohio police and fire retirement, but it goes to everybody. Give him a call. His number's up next.
To find out more, call the Lineweaver Financial Group at 1-888-313-4009 or log on to www.lineweaver.net. Next, a civil conversation about the war between the North and the South.